Choosing Change is a program through Contra Costa Health, and we provide patients with opioid use disorder with medication-assisted treatment, specifically buprenorphine, and group medical visits to support them with their substance use recovery. The quilt that you see behind me is one of many quilts that were created by our patients during the group setting. I think that so many of them oftentimes aren't able to verbally express the progress they've made, and I think it was helpful for some of them to be able to express the amazing things that they've done in their recovery by drawing it.
The model of care at Choosing Change is nurse care management. The nurses who work with Choosing Change basically have ownership of the program. They're the ones who get to know our patients the best because they're the ones manning the phone line. When they have their prescription and they go to the pharmacy and the pharmacy says, oh no, we don't have that prescription here, or like, you shouldn't be picking it up now, you should be getting it in a week. They have a number to call our patients, and within 2 to 3 hours, if not less, one of our nurses will call the pharmacy, set it straight, and the patient can get their medicine.
We get referrals from lots of different sources throughout the county. Once they get referred to us, we'll give them a call, we'll complete an intake with them, and then we'll enroll them in the program, support them with getting started on the medication, so doing an induction, helping them stabilize. Once they enroll with our program, we'll get them scheduled with a visit so that we can see them, and then they'll start attending groups with our care team. So we have a nurse, a physician or a nurse practitioner.
My favorite thing about this program is the staff, my doctor, his nurses are like 1 in a million. They're amazing. They have supported me so much through this. When I was first starting, just calling to check on me every day, going above and beyond. I don't feel like just the medicine is what helped me in my recovery. It's the fact that they sit there and they take the time to, just really get to know you and get to help you through what you're going through.
In the group session, we have a standard format that we follow. We ask them to introduce themselves, and we ask them to rate how they're feeling that day. Then we move into housekeeping, where we'll talk about, okay, who needs to meet with the provider after the group, because you need to talk about a dosing need. And then the next part of the process is diving into like a more recovery-focused discussion. We use a lot of motivational interviewing. We talk less and listen more. That's where you can really get from people what they're going through. And if you fill in the holes, you might not get the same information from them. And also, we are not the experts. Nursing is not the expert, providers are not the experts, our mental health clinicians are not the experts, the patients are the experts, and they know their own lives.
Substance use disorders don't come from nowhere. There are risk factors, people have trauma, and when you really can access the empathy and realize that the person that is strung out on the street, hunched over, that person has a story. If you get to know them, they will tell you that story. That's what we get to do a lot here.
I see really big changes with the people that we really get to know. We really see them go from being homeless or living in their car, not having clean clothes to wear or food to eat, to getting amazing jobs. They get apartments and they get the custody of their children back.
So a lot of people express like, this is a place like whatever else is going on, I can come here Friday afternoon, there's people that care about me, there's people that know me, and for an hour I'm just around people that feel like family. And as part of like a whole recovery, we can give the medication, and I think the buprenorphine is an important part of the treatment, but it doesn't rebuild human connections, and it doesn't all by itself just facilitate recovery.
The opposite of addiction is not sobriety. The opposite of addiction is connection. And so that's what we provide.